What are birthmarks? Birthmarks are marks on the skin of a baby noticed at birth or a few days to weeks after birth. Birthmarks can be red, brown or blue. Red birthmarks originate from the blood vessels. These can cause vascular birthmarks, the more common ones being an infantile hemangioma, port wine stain and a nevus simplex. Brown birthmarks originate from the pigment-producing cells of our skin that give us our skin color. If they produce more pigment but remain in the superficial part of the skin known as the epidermis, then they form a flat patch which is known as a café au lait. However, if they form deeper nests or collection of pigment cells under the skin, then they form a congenital melanocytic nevus, or otherwise known as a mole from birth. Blue birthmarks are due to deeper pigmentation in a part of the skin known as the dermis. They do not form a collection but instead are scattered in layers within the dermis. The nevus of Ota occurs on the face as it follows the distribution of a facial nerve known as the trigeminal nerve. On the other hand, a Mongolian blue spot usually occurs on the lower back, buttocks, or on the limbs. So then, do we need to be concerned about birthmarks? Most birthmarks are harmless and mainly affect the appearance. Birthmarks such as an infantile hemangioma, nevus simplex, and Mongolian blue spot may fade as the child grows older. More often than not, birthmarks are not associated with any underlying disorder. However, depending on the size, number, and location, they can signify an underlying associated syndrome and as such should be evaluated by a medical professional. In addition, birthmarks such as the port wine stain and nevus of Ota can now be treated early prior to school-going age. The response to treatment, such as laser, is better when the child is younger. Starting treatment early can reduce any psychological impact it may have on the child later on in life. I hope this video has been helpful to parents. Do visit your pediatric dermatologist if you need further advice and assistance.